Clerk, will you please call the roll?
Alderman Kennedy.
Here.
Alderman Moore.
Here.
Alderman French. Alderman Caro.
Present.
Alderman Carter. Alderwoman Murphy.
Here.
Alderman Ogilvy. Here. Chairman Conway. 5 present. You have a quorum.
Okay,
Oh, maybe you're right.
just so you know, we're going to start on page 258, and I guess, Melba, if you want to come up and explain your budget.
Good morning.
Good morning.
Before you, you have a packet. City of St. Louis Department of Health, an update. I want to turn your attention to tab 3. Tab 3, and it's the third brief on heroin data brief. I remember last year Alderman Vaccaro asked about heroin. So I wanted to, this year, take some of the questions that were asked last year and to provide you with some information. So we compiled an EPI brief, which outlines what the department is doing and our partnership with NCADA, the National Council on Drug Abuse and Alcoholism. But first, and secondly, the posters that you see to my left and to my right, the one to my right highlights sexually transmitted disease, one case that started in March. And just to give you a sense of how long sometimes it takes to address a sexually transmitted disease case and identifying partners, interviewing partners, and locating them. It gives you a brief diagram at the bottom at the people that were involved, and their confidentiality has been maintained here. But it gives you...
Sorry to interrupt. Is that in this book? Because seeing that from here is hard. Is it also?
Yes, the second brief is on sexually transmitted diseases in the third tab.
Oh, here, yeah, it's right here.
But this just gives you a visual of one case, where the cases are, and how we have to go outside the boundaries of the city of St. Louis to address and identify individuals. The two poster boards to my left give you an overview, and I know it's a lot of small writing, and then we did color code it. It gives you a sense of what we are doing in the Department of Health as it relates to this yellow section. Is, as we know, the hospitals have to do a community health needs assessment. So you see the things that we're doing and how it lines up with the hospitals. We have just submitted our documentation for national accreditation. So it shows you some of the domains that we had to meet in order to submit those documents for accreditation. And it lines us up with our initiatives, Healthy People 2010, 2020, and what we're doing as a department. So it gives you a brief overview, looking at it more down in the weeds as to what we're doing, okay? But good morning again, and thank you for allowing me to present the 2015-2016 operating budget for the Department of Health. The department is excited about the accomplishments achieved during the 2015 fiscal year. We look forward to providing quality programs to the citizens in the great city of St. Louis. This year, our department remained focused on the purpose of public health, operating under the core functions to public health: assurance, assessment, and policy development. To elaborate a little bit further, I want to give you an overview of what happened this year. Unexpectedly, we had Ebola. To date, the department has monitored 13 travelers. And our motto is that we work 24/7 to keep the public safe from lurking communicable diseases at home and abroad. During this process, when we were notified by the Missouri Department of Public Health at the state, an unplanned situation this year with Ebola. It charged the department with monitoring travelers who had recently been to West Africa countries that had been impacted by Ebola outbreak. After consideration of the guidance issued by the Centers for Disease Control and in collaboration with the Missouri Department of Health and Senior Services, the City of St. Louis Department of Health established protocols on monitoring the travelers and the impact from West Africa. The protocols include different levels of accepted movement within the community based on the assessment of the traveler's level of risk. We've heard a lot about our Youth Partner Prevention Project, which focuses on violence. Last year, we provided you with a white paper that talked about the goals for the department, and it included establishing plans for marketing progress on the St. Louis Regional Task Force Youth Violence Prevention. To date, we've accomplished, which is still an ongoing process, we track teens and children's, their deaths on a monthly basis, share data with appropriate agencies, develop public health messages based on the evidence. We continue to serve on the Child Mortality Review Panel. Accomplished through this, we have two dedicated employees to sit on that panel, an epidemiologist and a nurse. Assure that existing Department of Health services incorporate violence prevention strategies and goals into their program activities. In each program in the department, there's a focus on what that section will do as it relates to preventing violence or addressing violence. Develop an appropriate violence prevention public health campaign. This is ongoing, and we are working with our partners to develop and identify funding for this process. Evaluating the progress on the Youth Violence Prevention Plan. To date, identify work already happening at that which addresses youth violence prevention, the St. Louis Community Health Improvement Plan, SC2, the Mayor's Sustainability Plan. Those plans help us address those issues that have been identified by the Youth Violence Prevention. What we've accomplished: we created an asset map for the Youth Violence Prevention Community Plan, work currently, which includes the work that's currently happening in the city of St. Louis. We meet with potential project managers and key project stakeholders to establish roles and responsibilities. Again, this is in progress, and this is a continual process that we will have and embark upon. Identify a project champion to carry forward the Youth Violence Prevention Plan. And we're still doing that, and we're looking at identifying all of those champions that can help assist us in this. Custodian of records. I know many of you have heard about Homer Phillips, and what are we doing? We have developed a process whereby individuals have a dedicated telephone line that they can call in and to receive information on what they need to do, what they need to provide the Department of Health. The Department of Health is the keeper of health information records. Those records are covered under federal law, so we're bound by law and to maintain their confidentiality. To date, we have received 292 telephone calls and 112 authorizations, and those authorizations provide us with the release, that we can release their information out back to them, which also means then we can start to do our search to find or to look for their health record, and we've been doing that. We're working with the U.S. Attorney's Office, who's also reviewing the files that we have. So as we receive a request in, we go through our log to look for that particular record that falls between Social Security numbers, because that's how it's filed, between the last 6 digits of the Social Security number. So then we go and notify our medical records, National Record Storage Company, for them to pull the box that particular record might be in. This is a very laborious process because it's a manual process. These are all paper documents. So the process is taking a while. Emergency preparedness. July 28th, we're preparing for July 28th when we'll have a tabletop exercise, which will exercise our ability to respond to a public health emergency and activate our points of distribution in the community. Fiscal services. 14 years ago, when I started in the Department of Health, our fiscal department had some major challenges. We couldn't find documents. We weren't able to monitor our contracts and grants. We have now established a tracking monitoring system where we can track all of our grants, and we have it down to a science that we can just about find it in the process. And those grants are turned around within an 8-week period, and sometimes less than 10, 15 days. So we are able to track that, and that's a major accomplishment because we were not able to do that in the past. Obesity. Obesity is one of our other program areas that we're focusing on this year and last year. This year, an accomplishment with our obesity program is that we had 14,000 elementary school students participate in our Let's Move Flash Mob Dance on May the 8th, starting at 2 o'clock. So every elementary school at 2 o'clock on May the 8th took part in the Let's Move Flash Mob Dance, and that was 14,000 elementary school students. That's the first in my administration of knowing that that was coordinated, and that was 44 schools with BJC, St. Louis Public Schools, and with the Missouri Foundation for Health. Again, what I'm trying to show you is that we can't do this in isolation. We have to work with our partners, and we have to take the lead in providing them with the data on what needs to be addressed and how we go about doing that. Communicable disease. One of the focuses this year with our communicable disease program is going to be focused on women and girls. We recognize that March is National Women and Girls Month as it relates to HIV, but we want to do more in looking at women and girls and how we can help our young ladies stay focused and practice responsible sexual behavior and understand those consequences. This year, we administered 4,770 HIV tests, 51 confirmed new HIV positive cases identified through our testing efforts. Again, you have to work with your partners to achieve these kinds of numbers. 12,557 clients were reached through our various DEBI interventions, and those are those diffuse educational behavior interventions that we have through our partners and that are implemented. We're moving forward also with Better Family Life. Better Family Life has been an instrumental partner in reaching the clients that we're not able to reach. For the most part, when we do our counseling and testing, people have a tendency, they're aware of what we do, so they go into the services and to those clinics that we have services. But on the other hand, the hard-to-reach clients are those clients that we have found over the years, the past couple of years, that we need to work better in partnership with other people who are also working with those partners because of trust. They have developed a trust with that organization, and it just serves well for us to also work well with them too. Grants administration. The focus this year, for the past couple of years, has been on linkage to care. We want to link more people into a system of care. 80% of newly diagnosed individuals attended their initial office visit within 90 days of diagnosis. Now, if you think about being told that you're HIV positive and then getting you in to get you into your first appointment, that is a challenge because you're dealing with a lot of other issues at that time. Viral load suppression, 85% of newly diagnosed clients are virally suppressed. Our national best practice model, HIV engagement and adherence team. This, we had a poster session at last year's HIV conference in San Diego. And our funder, the Health Resources Services Administration, has complimented us on that and said it is a best practice and that we need to continue to do it and others need to adopt it as well. Environmental health. We were able to this year get our administrative fines fee in place, and we've started working with our community partners and to assure that there are violations that are identified, that they get into the system sooner and that they pay their ordinance fines and citations sooner so that they don't have a double in that, but that mechanism is in place. Women, children, and adolescents. As you know, we received funding from the National Institutes of Health in collaboration with our partners. During a 12-week period, 17 Latino, Caucasian, and African American mothers and fathers completed a parent mentoring program while their 22 children were instructed in physical activity and healthy eating. We are providing lead and asthma education and receiving direct referrals for services by having a presence in 2 of Grace Hill's clinics on specific days monthly. Father Support Center. The alternate site for parenting program was integrated into our men's health presentations on chronic disease, sexually transmitted disease, prevention, care, into their regular fatherhood programs and classes. Nurses have achieved a 98% compliance rate for age-appropriate immunizations among the schools served and completed over 100 health classes. These classes focus primarily on nutrition, physical activity, self-esteem, and bullying, communicable disease, and communicable disease, and they reached about approximately 1,500 children, parents, respectively. In closing, I wish to thank the mayor of our city and this body for your continued support and trust in my abilities to lead the department in providing services to the citizens of this city. I look forward to carrying out my budget and that has been graciously provided by this body. Thank you.
Just one real quick question. Do you see any shortfalls in the budget, or you're pretty good with it the way it is?
We're going to work graciously with what we received because we have plans in place, and it'll be a continuation of what we started this year.
Okay. Then Alderman Kennedy.
Thank you, Mr. Vice Chair. Thank you for your presentation and the information, first of all. I've seen you do very thorough work in the past, and I know you have continued to do so. When it comes to youth violence, what do you see, both in terms of programming and in your own projection, the types of monies that may need to be in place to really address it and curb the problem, start reducing it?
It's a big issue, and dollar-wise, I'd have to come back to you with a figure, but I will definitely say that it is a concerted effort of not just the health department. It is all of our partners involved. It's law enforcement. It's you talk about public safety. It's the schools. It's all of us working together on a comprehensive plan. Mm-hmm. And it's taking it looks at, if you think about our lead program, the process that we went through with our lead program, I would say it is the same due diligence that you have to have. You have to have someone that understands the social fabric of our community. You have to have someone that is a business person. You have to have someone that is a facilitator, and a facilitator of change. And it has to be someone that is a champion, and it has to be someone that's respected, that people will come to the table with that individual, and they can galvanize their efforts and work together and put together a plan. And when I say it has to be a business plan, it has to be able to, you have to be able to communicate in that plan the business, the economic impact of this on the community and on our families.
And nothing like that is in place right now, to your...
We have the undercurrent of the beginning cycle of that. Right. And I didn't mention, you have to have the academics involved. Currently, Washington University assembled a team last week, and I was in that meeting, and some of the other alderpersons were in that meeting, and it talked about gun violence. It's the same approach where you have to bring all of the stakeholders to the table and to sit down and ask the question, the what can we do, what can we commit to, and then how are we going to do that? So it's collaboration. It's
right.
Collaboration. It cannot happen in isolation.
Mm-hmm. Okay, it looks like from what you said, you and I perhaps can have a further conversation past this meeting.
Yes.
Because I would like to do so with you.
Okay.
And go into more details.
Okay.
On the Ebola protocols that you developed, there was no documented cases of Ebola coming through St. Louis, was it?
No, It was, we had one situation where a physician, and this is why it's so important that you have a plan and that you're trusted in the community. we had a plan on how we were going to address travelers. We had to stand up quickly to do that, and we put that in place. We had a physician who had done some traveling in Liberia and who was going back. So we had to really work with him and the state health department to understand the process of his return, that he would have to be monitored for 21 days, given his risk level. So you have to do the assessment of the risk level of the individual who's traveled there. You never realize this until you actually get into the implementation of the program, that you found out that we do have, on average, it could be maybe 100 people to come in to the St. Louis area within a year or so. That have been in certain African countries. So we were blessed, we were lucky that we only had the 13 so far, and they've been low-risk individuals, meaning that they had no direct contact with individuals in those communities that had Ebola.
And what staffing is dedicated, not just to Ebola, but those types of?
That would be communicable disease. It would be communicable disease, and our nurses. And I tell you, my staff, I can't do what I do every day without them, because they stand up quickly, they understand public health, and we're able to put plans in place.
Okay. All right, thank you. Thank you, Mr. Vice Chair.
Thank you. Alderman Moore.
We are winding down with the Ways and Means, and I must say that your presentation was the most thorough. We appreciate that. I know I do. Some others might debate it, but that's on them. But I appreciate what you brought in here. Most of them come in asking for additional funds and preparing to double their salaries. I'm worried about the dog catchers. We don't call them dog catchers anymore. What do you call those officers?
Double their salaries.
Animal care and control officers.
And you know, I talked to you a while back about the pit bull epidemic, and it still has not subsided. So I'm going to recommend that how many of those control officers do you have?
I believe I have 8.
You need 10, so I'm going to recommend that you get a couple more, or at least one. This is not the chair, so he won't fight me on it. So. But we definitely need another one of those guys out on the street. Mental health, city gone wild. So do we have additional facility for the people? A lot of them are doing wild things, and they need mental therapy instead of just being incarcerated. So do we have additional bedding, or have we seen an increase of that type of crime where we need to institutionalize them?
The need is
and what are the facilities that we have to house?
Well, the Department of Health does not have any programming to address mental health. However, we are in partnership with other agencies and organizations. I think it was earlier this year, the coalition, the North City County Coalition, was established, where the Missouri Department of Mental Health is a part of that. And we're looking at what can be done to open that pipeline. One of the things is, we've talked about this before with the St. Louis Public Schools, and how we need to have our educators trauma informed so that they can recognize trauma in the young people that are coming into their classrooms. You know, if little Johnny throws a book across the table, or if little Johnny is sleeping at the table, it might very well be because little Johnny was up all last night. And that impact of that. So while we don't directly have a program for that, we do work with the Mental Health Board. Jama Dotson is a great person. We talked about how we open up that pipeline so that for adults and children because sometimes the children are coming out of situations that parents need some assistance as well. So we're talking about trauma-informed individuals in the schools to be able to recognize it in the children, but we also want to make sure we open that up so that there's more access to beds. We've worked with the Regional Health Commission, which has Alive and Well. So I think everyone has a heightened awareness that there's an issue. And I think collectively we are moving closer together into how and what that low-hanging fruit is and how we can better address it to get people in services.
Okay, I also appreciate your visibility with the Board of Education coming with those programs, even though I have not attended, but I will be there in the future.
Thank you.
And I definitely appreciate it. Are you the commissioner now? You're not the part-time commissioner, are you? They're doing right by you. I hope.
I'm the acting director, Commissioner of Health.
Thank you.
Thank you.
That's all I have.
Just one question, because I'm taking notes. How much will it cost to add one more position for the dog catcher kind of thing that Sam's asking for?
About 45,000. And that includes benefits. That does include benefits.
So you understand we have to find that, but so I made a note of it.
Right.
Okay. French, let's see, Alderman Carter.
Yes, no, I just wanted to reiterate some of the things that my colleagues before me said. I think that you have given us the best presentation, and you have been more thorough than any other director that I've seen, and I would love to be involved in the conversations with Alderman Kennedy about the gun violence moving forward. No further questions, though. Well, no, I do have one. Are we in partnership with St. Louis County on anything else other than mental health issues?
Well, yes, we are there, and I failed to mention it. Thanks for reminding me. We have a regional STI group with Washington University. The universities are involved: St. Louis U, Wash U, City St. Louis Department of Health, St. Louis County Health Department. We're working together, and our Dr. Sonny Sager's at the table. The emergency room physicians are at the table, and what we have finally got to the point, which is another success, that you can't point the finger and say St. Louis City is not doing what they're supposed to do. Right. It's that we need to work collectively together. So we're at the table, and the state health department is at the table. So this is a newly formed group, and we've had our first meeting, and it is not about a meeting for the sake of meeting. There are actually going to be some outcome measures to this, and I'm excited about it.
I thought I read something recently where there was something where we partner regionally with St. Louis County just in terms of obesity and heart health and...
We have our obesity plan in Washington University, and I do believe there's a representative from St. Louis County that's a part of that as well. So it is obesity and STIs that we're working together on.
Okay, thanks. No further questions.
Mm-hmm.
Thank you. Alderwoman Murphy? No questions. Alderman Ogletree. Oh, I'm sorry.
Thanks. Health department runs has a lot of sections and kind of runs a lot of programs. From your perspective, what do you think are kind of the most important programs that you do? What are you most excited about in terms of maybe what has improved over the last couple of years, or what you think is coming up? And where's an area where it seems like there's a big need to improve or do better or do more, or sort of an unrealized opportunity?
What I'm excited about is that I was here 14 years, I've been here 14 years, and when I came in, our fiscal department was in shambles. And today, that is a well-run department. When I was appointed as acting director, I called for an audit in my department because I wanted to make sure, even though I was there, and I knew very intimately what the programs were doing and what the sections were doing and our fiscal accountability. I still wanted to hear, again, from another set of eyes. We had one finding with our A133 audit for our HIV, 1.5 findings with our HIV program. When I started, we had 4.
Just debatable.
So there has been it has been a continual process of improvement in fiscal. I'm very pleased with what we're doing in our marketing section, because we have to get the information out there and we have to market to the community and letting them know what we're doing. I'm pleased with that. I'm excited about what we've done thus far with obesity in the St. Louis Public Schools, because we're meeting people where they are. And that's what I can say. I'm excited about that because that's what our department does. We go to where the people are. We're not sitting waiting on them to come to us. So I like that. I like our partnerships that we have in our sexually transmitted disease program. If I stood back and had to pick one, there's always room for improvement. If I had to pick one, I would say within our sexually transmitted disease area, it's where I want us to have a little bit more footage and a little more grounding. I think the initiative that's in place now, the regional approach, that's the key. Again, you can't look at it in a silo because STDs just don't stop in the city or at Skinker. They go both ways and across the water. So I think it's important with this initiative of what we're doing. That might be the untapped area that we're exploring, those untapped waters that we're exploring. But environmental health, I'm very proud and pleased at what's going on there. You can't ask, I'm telling you, 14 years ago, the staff commitment, it wasn't like it is now. I mean, you have a team of people that are working. And when I say they're working, they are working. And they do it with style and they do it with grace. And I appreciate them for what they do.
Thanks. Maybe 2 unrelated questions. The animal control facility, I know we currently have a lease and we're looking at potentially buying that. Okay, so that'd be a good outcome in your mind to purchase that facility and make that our permanent home.
Yes, it would.
Okay. And then this may not actually be something that the health department's directly involved in, but I know there's been some efforts within high schools to get like a registered nurse or a primary care provider in
The clinics.
in the school kind of full time as a kind of primary point of access for health care for teenagers. Is that something the health department's been involved in at all?
We work with the schools. The St. Louis Public Schools has their own school health nurses. A lot of if you can remember, the first area was over at Roosevelt, where Mercy came in and established a clinic within that facility, which is a great concept. Over time, students became more comfortable with going in and getting their health care there. People's Health Center opened one also, and they actually had dental chairs in there. But it wasn't, sometimes when you do that, you have to give it some time so that individuals embrace it. You can't open it today and think that they're just going to run through the door the next day. So you have to give it some time. And from a business perspective, the bottom line is it a good use of your time? Is what those execs are looking at. So I think it's a great concept to have those clinics there. We work, like I said, across the table with the public schools and those school health nurses on a lot of things that we do as it relates to immunizations and tracking and monitoring cases in the schools, yes.
Thanks.
Does anyone have follow-up questions? Yes, Alderman Moore. No, he was just waving. Well, thank you so much for coming in. We appreciate it. And apparently we're going to work on finding another dog catcher for Sam, so.
Thank you.
Since we have no other business, we're going to adjourn.